Thank you. Thank you, everybody, for having me. My name is Kate, and I manage the Adult Day program here at Unionville Home Society. This program has been in operation for 15 years. We have seen many clients come and go, and we've seen many stay, some for even 5 to 10 years. Many of our clients see our program as a destination, a place to socialize, to develop friendships, including that of staff. I've heard many refer to our Adult Day program as senior school, seniors club, my club, and I think that that's a good thing. All our clients are referred to our program through the Home and Community Care Support Services, the Central Lynn. Once I've received the referral, I screen it against our eligibility criteria to make sure that that potential client is appropriate for the program. Once we have a vacancy, we would set up a half-day trial, which would include the programs, lunch, beverages, and snack on that day. And once we admit the client, they would then attend on a weekly basis. Since the pandemic, we have implemented virtual programs, and we've been able to open up these to our new referrals sitting on our waiting list. So for those interested, we can admit them and get them connected to an online virtual community within 2 weeks or less. The cost of these virtual groups are $2 per session, and we currently run 9 virtual Zoom groups per week. In January of 2021, we implemented virtual one-to-one personalized sessions. These are by appointment only, and they are between the client and one of our staff. The cost of these are $5 a session, and they run anywhere from 30 to 45 minutes. I'm now going to pass you along to my colleague to introduce herself and to speak to these sessions. Go ahead, Julie.
Hello, my name is Julie Robinson, and I am the activation programmer in the Adult Day program. I will be showing you a sample of a session with a client I see once a week. These sessions are unique to the client, using the DementiaBility All About Me from taking my DementiaBility training. The form captures the client's cultural background, their current interest, and things that they may not want others to know. They want others to know about them. I will share the clip with you now of my wonderful experience one-to-one.
One moment here. I'm just going to get the clip ready to go. My apologies. Can you all see the screen? Awesome.
It's really nice to see you today. I'm glad you could join me.
You're talking about me?
I'm talking about you.
I am very happy to see you.
I'm happy to see you too. And I want to say Happy Women's Day to you.
Oh.
Yeah, do you see the sign behind me here?
Yeah.
Yeah, it's a nice sign that one of our students put together for us.
I see.
And today is Women's Day, so we're celebrating women.
Okay, go ahead.
Because we're powerful. Would you like to sing a song for me?
In Arabic?
Yes, I'd love that.
على بلدي المحبوب وديني زاد وعدي والبعد كوي من بعدك ما بنام الليل على بلدي المحبوب وديني.
Thank you. That was beautiful. Very nice.
You're welcome.
I have a puzzle here. So
go ahead.
Go ahead. We're going to try and fit this puzzle together. All right, so it's a little girl blowing bubbles. How many blue pieces do you see, Teresa?
1, 2, 3, 4.
4, right. Okay, so I'm going to put one of the pictures up here, and I have her face. Do you see her ear? Do you see her ear here?
Yes.
Okay, so I have a part of her face. Do I put her face in front?
Inside. Push.
Push. Okay.
There you
Oh,
go.
excellent. All right, now I have her arm.
Yes, go ahead. Show me.
Do I put it in the front or the
Yeah.
back?
Yes, you could.
Where? In the
Go
front?
ahead. Up, up. There
Hey,
you go.
okay. Now I have her arm.
You go ahead. The piece is there. Come on, come on.
Where does it go? In the back or the
Come
front?
on. Up. There we
Hey,
are.
we're so good at this. All right, now I have her head. Does it go at the front?
Go this side. This side. Go ahead.
Oh,
Yeah.
all right, I have her face. Does it go in the front or the back?
No, the front. Go ahead. There you go.
Excellent. All right, I have some bubbles. They're going to go up in the air. Does this piece
There you go. Come on
Right.
in. Come on in. Come on
come
in.
on in? All
There
right. Now I have some more bubbles in the air. Does it go at the top here or at the bottom?
on top.
Excellent.
There you go.
And now I have some more bubbles. Does it go down or at the
Up
top?
here. That's it.
I have some more bubbles. Do they go here on the blue jacket or does it go up in here?
This one now. Up. There you go.
Excellent. And then I have a piece at the bottom. Does it go in here or does it go over here?
Over here.
Right where I have it?
On the
Okay,
beside the house.
All right. Does it go at the top or the bottom?
It goes on the bottom. There you go.
And look, we have one more piece.
Yes, ma'am.
Woo, we did very well. I really enjoyed reading with you and singing with you today. You have really made my day.
You're welcome.
My one-to-ones are so special to me, and I really like providing this service virtually to our clients that cannot be with us in person. Some clients that cannot be with us in person at this time. I use a variety of sources to create an experience for her. Some one-to-ones include a PowerPoint as a way to show familiar images close to our heritage. This stimulates reactions and thoughts and conversations. You can find many wonderful options on YouTube and other websites using simplified puzzles, trivia, music, travel expeditions to their home country or other places of interest. The clients are sometimes accompanied and supported by family who can enjoy the client's response. Thank you very much.
Before we finish, so thank you, Julie, that was awesome. Before we finish, I'd like to share a testimonial from this client's son on the impact of these sessions. So thank you very much for continuing to offer the virtual program. It has become very important in the management of my mother's condition and her quality of life. This engaging program has been a lifeline for my mother, who has been impacted by the pandemic. She is unable to go to physical day programs like she used to, and family and friends who used to visit don't, for fear of bringing contagion to her. So my mother is more isolated, which is exactly the wrong thing for her condition. While trapped at home, your program reached out. I would watch my mother wake from her seat on the couch in front of a television, teeter over to where the computer gets the best internet reception, and sit in front of the laptop, not fully understanding what we were going to do. Then Julie would greet her by name and my mother would perk up. I would watch my mother transform from an isolated and bored individual passing time to an enthusiastic and engaged participant of the virtual program. During the program, I would observe my mother's performance, improve in the various games or exercises Julie programmed. Whether it was songs, puzzles, or reading, my mother was actively interacting with Julie. All too soon, the program would be over. I would help my mother back to her seat in front of the television, only now she's energetic, happy, and often singing the same songs from the virtual program session. Her reinvigoration would continue for a while. I would expect the success of the program is highly dependent on the people skills and empathy of the programmer. Julie is fantastic for our mother. Her caring really shows and makes an impact watching my mother interact with Julie. Thank you again for continuing to offer this vital service for our family. So you can see from a service aspect, these testimonies are really important to us as they validate the very important work that's put into designing each session. So that includes a portion for the Adult Day program. I'm going to now introduce the last segment of today. And this includes the geriatric outreach team. So I also manage this team, and I am proud now to introduce another long-standing staff member, Janice Stober, who is a social worker and an esteemed clinician on this team.
Thank you, Kate. Thanks for having me today. I'm a social worker on the Southeast Geriatric Outreach team. And I'm going to share my slides here for the presentation I'm going to give you today. Do you see them online here?
We're not seeing them quite yet.
Okay, maybe that. There we go. How's that?
Perfect.
Okay.
We can see it, yeah.
Fantastic. So thank you for welcoming me here today. I wanted to share with you a little bit about the geriatric outreach team. A lot of people know Unionville Home Society, know the day program, and certainly know what they do, but a lot of you may not know about the outreach program. We've been part of this program, which is funded through the Regional Geriatric Program of Ontario since the inception, which is in 2008. So this program is under the leadership of North York General Hospital, and we are the only community-based outreach team. There are other outreach teams across Ontario, and the ones that are funded through this region, through regional geriatric programs, are at Humber River Hospital, South Lake Hospital, as well as Mackenzie Health. Those are the outreach programs there. Again, we're the only community-based outreach team. So we service clients in the community in the Markham and Stouffville and Unionville region. The vision of what we do through regional geriatric program is ultimately better health outcomes for older adults living with frailty. And our mission is to enhance the experience of aging one person at a time. And that's the UHS mission. Our purpose is we want to support seniors in the community who are at risk of losing capacity for independent living. That's very important to us. We all want to live the best that we can be, and whether we're living in a retirement residence or whether we're living at home with family or whether we're living independently in the community, we want to assist seniors living the best that they can. Again, the goal of the program essentially is to prevent admission to hospital, readmission to hospital, or delay long-term care or in placement of some sort. We want to identify the risks within the home, and we want to provide resources and linkages to mitigate risks. So in other words, we may see folks in the home and they may be experiencing falls, they may be experiencing cognitive issues, and they may not know how to reach resources or how to navigate the whole system in the community. So we're instrumental in doing that, of providing linkages. Our role also is consultative in nature. So we're not like case management, like some of you know home care case managers from the Central Inn. We go into the home or virtually, we assess, we link, and then we discharge. So we stay involved until we are certain that you're going to be picked up appropriately by somebody in the community. The focus really is on frail or vulnerable seniors whose health and dignity and independence are at risk. Some clients are solely homebound, so they have not gotten out of the home, and that's certainly sure with the pandemic over the last couple of years. They may be living independently or with family or in a retirement home. And a lot of folks have multiple complex medical issues or psychosocial issues or psychiatric issues. You know, it may be one reason why we're being referred. However, there may be a multitude of areas of concern that we may see once we do speak with family members. Also, we look at a recent unexplained breakdown in health or a level of function. So if there's a shift in functioning, if a person was independently able to do everything in their home and all of a sudden they're not eating as well, or they're falling more frequently, or they're not remembering some things, there's triggers to get us involved. You know, eyes in the home are so very important. People go to doctor's offices or clinics and you see people face value, and that's really not what is in the home. When you see people in the home, how do they manage their medications? How do they walk in their home environment? How are they eating? What sort of meals are they preparing? Are there burn marks on the stove? Things like that. Really, there's nothing that replaces this type of visit. So the primary reason for referral to our team is to assess the home situation and get a different perspective. Often doctors refer to us saying, I don't know what's going on in the home, I just see what's being presented to us. So yes, so that's what we spoke about. So who's our team? I love this slide because we're all so active here. You did meet Kate Papillo, and she's our manager and our best advocate, and she's the manager of the day program and also of our Southeast Geriatric Outreach program. Cynthia Lee is administrative assistant, and she's just wonderful, and we don't know what we would do without her. Dr. Heather Curry is our fearless leader. A lot of you do know her from Unionville Home Society, from Unionville, and she is the doctor, our consulting physician on our team. And there's Jane, who is our nurse navigator and our nurse on our team. And there's myself with my little dog, Cassie. And I've heard it's National Puppies Day. So although she's not a puppy, she is geriatric. She's 12, and in dog years, that's old, or a senior, I should say. So happy National Puppies Day. So I wanted to show you this diagram here because this really does show you how we work collaboratively with our partners. So there's a lot of acronyms here, but I will go through each of them. So we're in the middle. This is Southeast Geriatric Outreach Team. And then up on the top, we have Markham, MSH stands for Markham Stouffville Hospital. So who refers to us and who collaborates with us? That's the Seniors Health Clinic. So a lot of folks see a geriatrician or may not see a geriatrician, but after they see us, we may link them to one. So that's the Seniors Health Clinic at Markham Stouffville Hospital. The other linkage we have is with the Seniors Home Support Program. So if folks are homebound and they need a home visiting physician, we can make that linkage, and that is with Dr. Elizabeth Mewey. And then there's the Markham Stouffville Hospital Care at Home program, which is a relatively new pilot project at home for enhanced supports for a short period of time. So that's a lot of supports from different agencies when people are at high risk and they get involved again, which is time limited. Another one of our champions is Markham Stouffville Hospital, GEM, G-E-M, Geriatric Emergency Medicine nurses. And those are the frontline people who see you folks who sometimes go to the hospital, who present with a fall or a medical issue, and they're very concerned about seniors they see in the emergency room, and they refer to us. So a referral may come from Markham Stouffville Hospital. Geriatric psychiatry is another linkage that we make, or we can be referred. Our team can be referred by a geriatric psychiatrist. And those are physicians that have a special focus in seniors that have psychiatric issues. that may have a history of anxiety or depression, or maybe experiencing delirium or psychosis, whatever has to do with psychiatry. So that is a geriatric psychiatrist. Family members. Often, I get repeat customers. So sometimes I've seen somebody 2 years ago that kept my card, and family calls me and said, Mom's not doing so well. Can you please see her again? So we get self-referrals. Also, even clients or spouses can refer to our team because we can see them as easily. IPOP is the Integrated Psychogeriatric Outreach Program. And that is through an organization called LOFT. And it's a similar team to us, but the focus is more geriatric in nature. And they have, rather than a consulting physician attached to that program, they have a geriatric psychiatrist. So we work in partnership with them. So I may see somebody who I feel would benefit from geriatric psychiatry. They may not need the whole team approach, because if I certainly did the visit, so I would refer to them. The Alzheimer's Society is one of our great champions that we work with. We refer a lot to them. They provide a wealth of information to family members and clients regarding dementia, and supports to caregivers as well too. So we often refer to them, and they have wonderful social workers there who can provide support to folks in the community. Again, BSO Loft is the same sort of organization as IPOP, as I just described, but BSO is Behavioral Supports Ontario. And those folks really provide support to families who are really struggling with managing family members' responsive behaviors. So what are responsive behaviors? It can be verbal aggression, it can be non-compliance, it can be difficult behaviors for folks to manage. So often I work again in collaboration with that team. Central Lynn, you all must have heard of Central Lynn. Some of you do receive supports from the Central Lynn. They're also known as Home and Community Supports. And that's an organization where you would receive referral supports such as bathing assistance, nursing care, occupational therapy, physiotherapy. Often I go into a home and sometimes there's no equipment needs. There's equipment needs and there's no adaptive equipment in place. So we really need a home safety assessment, or there has to be nursing care that's involved for a wound. So we get involved with them, and often we receive referrals from them. And community primary care physicians is a wonderful champion. We have a group of family physicians, whether they be with health teams in the community or whether they be working independently. We have been in the community for quite some time and we're quite known. So we have a variety of different doctors who do refer to us, and we're always telling them about our service. So that's certainly the group of people who we refer to, as well as who refers to us. We're quite proud of that championship we have. So what are the reasons for referrals? There can be a number of reasons. A lot of them are a decline in function, right? So it can be upon presentation to the emergency room, family members concerned, family doctor sees a concern, another community partner that's recognizing issues. A lot of them are mobility, falls, after surgery, just not the same. So we get mobility falls, functional decline, home safety concerns, medications, polypharmacy, which means a lot of medications that they're on, pain management issues, sleep disturbance, either not sleeping too much or maybe sleeping too little, weight loss, nutritional issues with seniors is very common. What I do hear of a lot of times when I go into people's homes is mom or dad is just not eating as much, or they'll take, a soup can and just open it up and heat up a soup, or they're grabbing toast and marmalade. It's just not the same as it used to be, and they're losing weight. So therefore, there's a lot of nutritional concerns. Incontinence, whether that be bowel or urine. Why? We always ask why. Why are these things happening? And that's very important to look at. Social isolation. Well, the last 3 years has certainly challenged everybody with social isolation, and the seniors have been most affected by that. It's been very sad to see this. We've had wonderful programs through UHS, like the day program that has offered virtual support, and it was so wonderful to see that presentation. So Things have been offered, but not everybody has virtual capacity. So therefore, social isolation has been a big one. And I think it still is resonating. It still is present for a lot of folks. And there's been a lot of deterioration from that social isolation for the past 3 years. Cognitive changes, even slight cognitive changes, are very concerning. And we receive referral because there is a presentation of change in behavior, change in memory, delirium, hallucinations. They can be a result of a medication or an underlying infection. There's lots of reasons. We have to dig deep, and that's why we get involved. Depression, again, we have seen that more and more over the last 3 years, and depression certainly has affected people's ability to function. So sometimes it's like a vicious cycle. A person may be depressed, they may be more social isolated, they're not eating as much. So again, the referral can be for a number of reasons. Verbal or physical aggression, that can be a newfound responsive behavior as a result of, it can be progressive cognitive decline, it can be a result of medications, delusions, hallucinations. Unfortunately, wandering. We do see people with advanced dementia who are exit seeking and wandering outside. So we get involved, and we have a lot of community partners that can help with that, such as the Alzheimer Society and the YRP, where there's programs we can link people up to. And caregiver stress. They hold the bulk of a lot of the stress as well as the client, and it's very difficult for them to manage when there is functional change. And family issues, of course. And elder abuse, unfortunately, there are some cases that we get involved in that people present to the emergency room in pretty bad condition. It doesn't have to be physical abuse, but it can be financial and neglect as well too. So we do get involved in situations like that, and they're the reasons for referral. And what is our inclusion and exclusion criteria, which means who do we accept and who can't we accept? So we accept seniors generally 65 years and older. However, we can, if somebody has geriatric needs, so if somebody is 55 and who's having cognitive issues and who's falling, we certainly would look at that referral with multiple comorbidities, which means a lot of medical issues, or there's been a decline in function or cognition. And so we get involved in folks with those. People who are vulnerable or frail, and also people who have complex medical situation or psychosocial issues. There may be caring for an adult who has a developmental delay at home. And one of the big stressors for a senior couple is their son or their daughter who's living at home, who they've never implemented any resources for. So we guide them accordingly. Folks have to live within our catchment area in the East York region. So actually that is from the 404 in the west to Durham Town Line in the east, and Davis Drive in the north, and Steeles Avenue in the south. So if they're out of that catchment area, we do warm transfer these seniors to other geriatric outreach teams in the community. Who don't we accept is those who belong to a family health team. There is the Markham Family Health Team, for example, that has just implemented a new program called Time to Thrive. So those folks who are rostered with that group or any other like group, we would have to get consent to touch one of their patients because they have their own support team. And those who live outside of our catchment area go to an appropriate geriatric assessment clinic or another GOT team. Okay, so our model of care is interprofessional, collaborative, and consultative, and not case management. I'll explain what interprofessional means. There's Jane and I. Jane is the nurse, I'm a social worker, and there's a doctor. We are able to do Jane and I, and once we had a physio and an OT on our team as well, and we're hoping to include that in the near future, is we can do the same job. Although she's a nurse and I'm a social worker, I don't go in functioning as a social worker. I'm trained as a social worker. She's trained as a nurse, but we both are trained in the same way to do this type of interprofessional assessment. Our role is consultative, so we don't take over management. We go in, we establish a relationship with the folks we're assessing. We link people and then we move on to the next person, but we don't leave anybody hanging. We make sure that they're well linked. Again, and I just described that, what type of visit do we do? The gold standard type of visit really is an in-home visit, and that's what we're known for, because you really are the eyes in the home. But the pandemic has taught us a lot, and it's taught us how to work differently, and how to provide a type of care where we can assess, but we can do a hybrid model. And even now, sometimes we decide to speak to people over the phone first, gather some information, or sometimes we do telemedicine through the Ontario Telemedicine Network, OTN, and we schedule a telemedicine visit. Not all people have virtual capacity, or some people are hard of hearing and they can't hear over the phone. So we have to be creative in how we deliver our care. So we are quite adaptable, and we've learned to do that, as many people have over the last 3 years. So what is the process? What do we do? How do we receive a referral? So a referral is usually faxed into us. Yes, we use the old fax machine, but it does work in the medical world still for us. We receive a referral. Usually Jane does a teletriage, and she looks at the appropriateness of the referral, the urgency, and the timeline. We look if they're within our catchment area, and if not, then we warm transfer them to the appropriate clinic. If there are clearly behavioral or psychiatric issues, and they're not really just geriatrics, but it's specifically having paranoia, hallucinations, behaviors, we would refer that to another team who can best meet the needs of the client rather than taking it on. So that's what I talk about, is the importance of collaboration with our community partners. That circle that I showed you is so very important, because it's the nature of the relationships that we have with our community partners that really go a long way in getting people to be seen faster. Jane triages, and when Jane's away, I triage, which means I speak to folks, I speak to family members, I book an assessment, and we schedule a visit, whether it be either OTN, by telephone, or in person. During the course of the pandemic, when we've had lockdowns, we've had to scale back going into people's homes, and now we're back in the community. So we're quite happy about that. And again, we describe our model as a hybrid in nature. Following the assessment, what we do is we do a comprehensive report. It's quite lengthy, but it really is good in terms of really getting to the heart of the matter. And this is what we have to look at, is why is this happening? What are the triggers? Is a person having behavioral issues and they're hallucinating because there's an underlying urine infection? What is going on? So we try to peel away the layers of issues. We develop recommendations, and they're left with a lot of recommendations we email to family members, such as resources, because it's better to email them rather than to leave them there. We mail them the old way, or we discuss them over, on the internet with them. We have weekly rounds with Dr. Heather Curry, who writes medical recommendations. So once everything is done, we send this back to the person who referred it to us. So it's usually a family physician, one of our community partners, and we attach our report so that everybody has, with the exception of the family members, because we can't keep sending our reports to family members. So we tell people that if they want to access the report, they can get it from their family physician. And then we fax them our referral, our report, as well as the recommendations to the primary care physician and to the appropriate resources. That's where we make the linkages. So if somebody needs a referral to an occupational therapist, I will make that referral. If they need a referral to a seniors health clinic, I will make that referral. I will not leave that to the responsibility of the doctor. And then we do follow up with client and the family and the caregivers to review these medications. So, Mr. and Mrs. Smith, have you heard back from the central? And oh, you haven't? Oh, that's strange. So let me call to find out. And sometimes I'll call to find out, and so many people are getting inundated with calls. They don't know who is who, and they may have said, no, I don't need any help. And then I have to clarify that. So I stay involved to make sure that the linkage I made is appropriate, followed up, and accepted. Or if not accepted, we chat about that. So that's our sort of the trajectory of what we do and how we go about doing it. I'm open to answering any questions anyone has, and I hope this was clear. It was a lot of information presented, but if there's anything I can be clarify for anyone, please feel free to ask me the question.
Hi there, Janice, thank you so much for that presentation. Before we take questions, I have a special guest in the room, a couple of special guests. We have our local MPP, Billy Pang, who is the MPP for Markham Unionville, who is here, and I would love for him to make some quick remarks. We also have the CEO of New Unionville Home Society, Abby Katz-Starr, in the room.
Good afternoon, everyone. I'm Billy Pang, MPP for Markham Unionville, and I am
Can't hear.
MPP Pang, I believe you might be muted.
okay. Let me start again. Good afternoon, everyone. I'm Billy Pang. I'm member of Provincial Parliament for Markham Unionville, and I'm pleased to help close the virtual Senior Active Living Fair. I want to thank Abby, Maria, Maha, and the amazing team at Unionville Community Center for Seniors for planning such a stellar event for our community. The wide range of workshops offered today were full of knowledge and practices that can lead to the healthier and happier life. Ontario seniors have shown great resilience over the past 2 years, having to adapt pandemic restrictions that often stop us from seeing loved ones. This is why Ontario's Ministry for Seniors and Accessibility is proud to support and fund events like this. This event highlights the importance of supporting Ontario seniors, and its impact will be felt far beyond the participants of today's event. With that, I want to thank all the participants and the organizers for such a wonderful virtual Senior Active Living Fair. Thank you, and turn the floor back to Maha.
Thank you so much for those kind and inspiring words, MPP Pang. I do know that we also, again, have our CEO, Abby Katz-Starr, in the room. Abby, would you like to make any remarks at this time?
Okay. First, I want to acknowledge our great MPP. Billy Pang has been a tremendous supporter and has opened many doors for us. So we are grateful. I'm thrilled to actually see this happening here. Many of you may not know, but when I was the Assistant Deputy Minister at the Ministry for Seniors and Accessibility, this is one of the programs that we were very proud to support and fund and grow. And so to actually see it happening in my own Seniors Active Living Center here is tremendous. So we're grateful for the government to continue the funding, to increase the funding. There have been more fairs this year than I think there's ever been before, and that is remarkable because we do share so much important information and so many people can benefit from it, even virtually, even if we're not in the same room. We're still able to really share and help and navigate what can sometimes be a very complicated system. So I won't take any more time. I thank all the participants. I thank all the presenters. And above all, of course, I thank our MPP for taking a few minutes out of a very busy day with his team to join us.
Thank you so much, Abby, for joining us and for those wonderful remarks. I do want to turn attention back to Kate and her team. Kate, do you have any, do you have a time to take a few questions if we have any in the chat? So if there's anyone who has any questions about the Adult Day Program presentation or the presentation about the Southeast Geriatric Outreach Team, by all means, you can drop your questions in the chat or unmute. I'm not seeing any questions at this time, but of course, if anyone has any questions that occur to them later, just like with the other presentations today, please feel free to get in touch with me, and I will be happy to connect you with Kate, Julie, or Janice, provided I have their permission to do so as well. Thank you so much. I know we're a little bit over time, folks, so I do just want to share with you a couple of closing remarks on my end before I let you go for the day. So on behalf of the Unionville Community Center for Seniors, I just want to thank all of our FAIR partners this year for joining us. CHATS, Lifeline, New Unionville Home Society, of course, the Alzheimer Society of York Region, Vision Loss Rehabilitation Canada, Social Services Network, Canadian Hearing Services, and Novo Peak Health, and of course, as Abby alluded to as well, the OACAO, which is the Older Adult Centres Association of Ontario, and the Ministry for Seniors and Accessibility were absolutely instrumental in helping us get this fair organized for you, because among many other things, they help provide funding and support for this fair and for many other initiatives for seniors active living centers across the province. So thank you to all of our fair partners once again. If you missed or want to review any part of today's presentation, it was fully recorded, so we will be posting clips of each presentation to our organization's YouTube channel, and we'll be sharing that link with you if you pre-registered. We have your email address already, and if you are not sure if I have your email address, I will share mine at the end here for you to send me an email, and I would be happy to share that information with you. We'll also be providing you with a digital resource package in the next week or so. So if you'd like a copy of this post-event package, please again, email me. My email address is mnaqi@uhs.on.ca, and it's on the screen there as well. We will also be sharing a post-event survey with you, and we would sincerely appreciate your taking the time to fill it out. We will share it via email in the same email as the one in which you will receive your digital package. And if you have any other feedback for us, please feel free to share it with us via email. Finally, if you're interested in learning more about our community center, the Unionville Community Center for Seniors, and the programs and services that we offer, please reach out to us. You can reach out again to me at that email address, or you can call us at 905-477-2822 extension 4235. And on behalf of everyone here at the Unionville Community Center for Seniors, I want to thank once again all of our presenters, all the participating organizations, MPP Billy Pang, CEO Abby Katz-Starr, the OACAO, the Ministry for Seniors and Accessibility, and all of you for joining us today. I hope you have a wonderful rest of your day.